If you're in residency and struggling with imposter syndrome, you're probably trying to fix the wrong problem. And that mistake is probably holding back your performance in the OR, rounds, or on call. In the next few minutes, I'm going to show you the exact shift that took me from feeling behind to performing with clarity without waiting for years to feel confident. Stay to the end because this is the part nobody teaches you. Fast forward 1 year, you're calmer on rounds, you think faster under pressure, and the OR feels more predictable. The difference isn't just experience alone, it's how you prepare outside the OR. In this video, I'll break down the system that lets you progress faster than time alone. Why imposter syndrome disappears once preparation becomes non-negotiable.
Here's the key idea. Imposter syndrome is usually a preparation problem, not a confidence problem. Elite performers don't wait until they feel ready. They prepare so thoroughly that confidence becomes a side effect. And that's exactly how athletes train. They don't just show up to the game hoping to figure it out. They use structured drills, film study, playbook, feedback loops, and town-bound goals. Medicine should be no different. Let's talk about managing patients. High-performing residents don't memorize random facts. They use algorithms, frameworks, and checklists. For example, abdominal pain comes in with a structured differential. You actually look at what are the pertinent positives and pertinent negatives to rule in, rule out, and then create an algorithm that you could follow so that you can create a differentials, work them up, and then treat them appropriately. Same thing with sepsis, in which it's protocol-driven management. Postoperative complications, they usually come in a predictable pattern. So really expecting the things that could happen, knowing what workup can cause tachycardia postoperatively, whether it's actually going to be a missed injury, it's going to be sepsis, or acute blood loss anemia, those are things that go through your mind, and then based on your clinical exam, you can factor those things out and then order the appropriate labs to confirm your differentials. And in order to make this work, you have to use core textbooks, specialty review books, short and targeted videos, and institutional protocols. All of this information need to be understood very well and processed so that they could actually make sense in the clinical setting, and translation into clinical application is actually the key. Your goal is not to know everything, it's not to start from zero. Almost 98% of people watching this aren't subscribed. If you're a medical student or resident who wants to think more clearly, prepare more efficiently, and perform better under pressure, this channel is built for you. Click the like and subscribe button and let's keep on going. That's how decision-making speed improves. In the OR, imposter syndrome hits hard. Here's how to beat it. Review the operation steps the night before. Watch 1 or 2 high-quality videos. You have to know the key anatomy, the critical steps, where things could actually go wrong, and who you're working with, what the attendings will likely ask, and what their preferences are. You have to be thinking like a surgeon. You become what you prepare for. Acting like one and taking responsibility allows you to become prepared, create those opportunities, which develop the skill sets, and through the process, become one. Prepared residents stand out immediately. This is a massive performance booster that most residents ignore. Every attending has different incision preferences, different suture choices, different ways of setting up the room, and different expectations. What you have to do is pay attention, write it down, and then adjust. When you align with a surgeon and a team, you actually go from slow and unsure to solid and dependable fast. The worst thing you can say to a surgeon in his own room is, this is how so-and-so does it. What you have to know is how he does it, and then do it the way he does it with him, because it's his patient. When you put it in a sports mindset, athletes don't say, I'll just play more games and hope I get better. They train outside the arena. Residency is the same. Deliberate practice of your surgical skill set outside of the OR
and being particular about improving your time, dexterity, and efficiency of motion.
Reading after shifts, mental reps, pre-round preparation, and focused improvement goals. You have to be measuring things, but you also have to have targets, which are time bound. Because if you don't, time will actually just progress without noticeable improvement. And when you have metrics that is time bound, you can assess whether you're hitting your goals or not. Waiting to learn on the job is the slowest way to improve. Preparation compresses time. If you feel imposter syndrome in residency, remember this. You don't need to feel confident to perform well. You need systems that let you perform despite comfort. Confidence comes later, after repetition, structure, and preparation. If this helped you, please click the like and subscribe and comment what part of residency triggers imposter syndrome the most for you.